this is Dr. Live with New Insight, and thank you for joining me in another video. The title of today's video is You Are Not Your Diagnosis, Why Professional Help Matters. Understand that no label or diagnosis defines you. They may define behaviors or symptoms, but they do not define you as a person, nor do they have to dictate your quality of life. With any condition, it is important to be wise and make smart decisions regarding your self-care and daily living habits so that you maintain the best level of functioning possible. Don't do things that work against you, meaning things that perpetuate and worsen your condition. Also, understand that just because you have symptoms of a condition or disorder doesn't mean those symptoms meet criteria for a formal diagnosis. Therefore, you may not have the condition or disorder at all, just symptoms of it. There are always exceptions to the rule, and this is why it is imperative to seek help from a licensed and qualified professional who can provide the testing, assessment, and evaluation needed to make this determination. Also, it is equally important that you take accountability for yourself, including the choices and decisions you make and the consequences of those choices and decisions, whether positive or negative. Face your issues, own them, and actively work on them by gaining knowledge, learning new coping mechanisms, changing your mindset, changing unhealthy habits and counterproductive behaviors, and seeking professional help if needed. Don't view yourself as sick or weak, and don't lean on any diagnosis like a crutch, whether it be physical, mental, or both. Don't think just because a medical or mental illness is in your family that you will automatically have it too, because this is not always the case. But even if you do develop it, you can live and cope with it in a different and healthier way. Remember, someone else's fate doesn't have to be yours, even if you have the same condition or circumstances. Don't use a diagnosis as an excuse, for example, to avoid responsibility or accountability. The diagnosis can be provided as a reason why you think, feel, and respond the way you do, why you may need certain accommodations, for example, at work or school, and why you choose to make certain decisions in efforts to avoid or better manage your triggers. However, there is a difference between reasons and excuses, and even valid reasons can become excuses if you're using them too frequently or to avoid responsibilities. Also, with any knowledge you take in, be mindful of tailoring the knowledge to your situation. Coping skills and therapeutic interventions are not a one-size-fits-all. Yes, there are certain interventions that will overlap, but each individual and each circumstance is unique, and therefore the recommendations, advice, counsel, and support will also need to be unique and tailorized in order to be most effective for treating your specific issue. Always strive to be solution-focused and to adopt positive thinking and positive self-talk. Negative self-defeating thoughts and negative self-defeating language will only worsen your mood and reinforce your symptoms, because the more you think negative, talk negative, the more you will feel negative, and the more negative behaviors and energy you will produce. Take your medications as prescribed. Allow your doctor to make any changes you need. Do not self-medicate. Go to counseling and therapy if needed, but most importantly, adopt a growth mindset and be open to change. Open to the DOC acronym, which is doing things that are different, opposite, and challenging in order to form new and healthier habits. Positive coping starts with getting in the right mindset, making a conscious decision to make the shift, regardless of your feelings, regardless of the level of difficulty to do so, and regardless of how others may think, feel, and respond. You understand that it's your path, your journey, and you have to direct your steps in a direction that leads to the betterment, not the detriment of your life.